All right, guys, the next study looks at the anti-inflammatory diet. You know, we promote this diet consistently on our show. Anti-inflammatory diet is very important to help promoting health in general. But a new study has now shown that anti-inflammatory diet may improve the colorectal cancer survival rates. And that should be very obvious, guys. We know that anti-inflammation is one of the biggest issues inflammation is one of the biggest issues that affects the body. It can cause so many different ailments, cancer being one of the big ones. And we know that many countries that have a naturally anti-inflammatory diet, meaning high in fiber, high in fruits and vegetables, low in processed fats, things like that, processed meats. I think we talk about the African diet, one of the better diets, in my opinion, because it's actually big on fiber, big on plant intake, low on processed foods. And for that reason, a lot of people in Africa, especially West Africa, have extremely low levels of colorectal cancer. So, these things have already been known, but it's good to see now more data showing that explicitly. And this came out on the latest research presented this week at the 2025 American Society of Clinical Oncology annual meeting in Chicago. And what they found was that people who use the anti-inflammatory diet, and these are people who already have been diagnosed with colon cancer. So people know they have cancer. They've been treated. They went through the chemo, went through all the intense treatments, were considered clear of cancer. After their treatment, they went and put them on an anti-inflammatory diet. This study took place over 3 trials that ended in 2010. And they found that the trial had about 2,526 patients. So a good number, 2,500 is a lot of people. You start getting some real correlations with that once you start looking at the lifestyles and so forth of that number of people. And they found that those who had colon cancer and they had surgery with either 3 to 6 months of chemotherapy, and they found that those who had, they put some groups on a lifestyle modification, meaning put them on an anti-inflammatory diet, put them on a physical activity regimen, and the other ones, they let them do what they wanted to do. And they looked at about, 1,600 people went on this special diet and so forth. And what they found was that those who were on the anti-inflammatory diet, which is, again, a diet of fruits and vegetables, leafy greens, coffee, tea, all my favorite things, but yes, anti-inflammatory foods were critical as part of the diet. And they found that those who were on this diet had a significantly decreased level of cancer recurrence. So they actually specified a 63% lower risk of death compared to those who consumed most pro-inflammatory diets, which is like pizza, going out to get processed fast food, highly processed foods and things like that. So we know that, anti-inflammatory diets are the key to long life. We know we've been saying this, we've been preaching this. Go look on my previous shows, guys. I talk about this at length. As many podcasts, we discuss some of the main benefits of anti-inflammatory diet and how to make your own anti-inflammatory diet. But now we're seeing that the scientific community is saying that, listen, guys, if you've had cancer, this diet can make you live longer. So if you've had cancer and it makes you live longer, what if you never had cancer? It can probably prevent cancer too, right?